My name is Dr. Thomas Schuler. I'm chairman of the Medical and Scientific Board of the National Spine Health Foundation.
Hi, I'm Tao Allen. I'm a fellowship-trained physician assistant.
Dr. Schuler, what is arthritis of the spine?
Most arthritis of the spine is osteoarthritis of the spine. Osteo is the degenerative arthritis. If somebody has rheumatoid arthritis or another type of inflammatory arthritis, that's a different story, and that needs the team of the rheumatologists involved to help it. But for this degenerative arthritis, this is what we treat as spine specialists, and this is what we manage. And so working with the right rehab or therapy, maybe adding in appropriate injections, medications, that is what we do and are able to help solve people's problems with this. Arthritis is the breakdown of the normal structures, and it really is the cartilage which lines every joint. So every time you have a bone that has to move, there's cartilage in between those surfaces that form the joint. And it's the breakdown of that cartilage, which can happen because of an injury. Most likely it happens because of genetics, wear and tear, aging, and that starts to break down so that the joints don't move so smoothly. So in the spine, we have to go back to a model and say, what are the joints of the spine? And the joints that we talk about are the three joints that form each level: the disc in the front and the facet joints in the back. And the facet joints move up and down. Well, there are 50 facet joints in your spine, from the neck, thoracic, all the way down to your low back. 50. That's a lot of joints that can go bad. Doesn't mean they all go bad, but all it takes one to go bad for you to have pain. So arthritis is where you break down that joint and then you can have pain. And there are nerves that innervate each joint, which can perceive as, to the patient, as back pain. So when you have a problem, when it's restricted, it's back pain. When it's arthritic, it's back pain. And if you start to break these joints down too much, then you get an instability where the spine starts slipping and sliding, which can then pinch the nerves and cause pain down the leg in addition. So I think an important concept in understanding the spine, a critical part, is to understand how much symptoms people have in their neck or their back versus their extremities. Because when it's in the extremities, it tends to be more a nerve irritation. When it's in the back, it tends to be more these arthritic problems, these degenerative problems that are leading to it. And that's what we as specialists have to figure out, is how do we determine what the problem is? Because you need to understand the problem to come up with a treatment. And they can all be very different. But arthritis of the spine is where you get this degeneration, you can get spurs. And the problem with that is the spurs can then pinch a nerve, which can present as symptoms down the arm or the leg, when in fact the problem is arthritis of the spine.
I always like to share with them that, life being a degenerative process, and unfortunately as we age, our spine ages with us. So arthritis is normal in the spine, and it can be, it can cause symptoms and sometimes cannot. And so for us, it's about identifying if the arthritis is a problem for that patient.
Yeah, that adage that life is a degenerative process is reality. Nobody likes it, but it's a reality. That again is why motion is so critical. And we talk about a rolling stone gathers no moss, and that's what's so critical for our patients to understand, that you have to keep working on your strengthening your flexibility to function. And if you don't use it, you're going to lose it. So you gotta be actively engaged and committed to a process. I don't care whether you're 25, 55, or 75. If you're not actively doing this, and especially the older we get, the more we have to invest time into that to make sure we have that success.
So Dr. Schuler, patients have asked if they have arthritis in the spine, can they prevent it or make it go away?
Well, those are two different questions. One preventing it, one making it go away. So preventing it is you do that by not using nicotine, by lifting things properly, by keeping your motion going. In spite of that, genetics is going to drive what happens. So you may not be able to prevent it, but there are things you can do to try to decrease the risk or stress, which is nicotine avoidance, maintaining a proper body weight, working on a good strengthening flexibility program, getting the proper nutrients into your body, because that helps the cartilage stay healthy as best it can. And so whether it's vitamins or proper diet and not being overweight, but all those things are ways that you can try to slow or prevent the problem. Nicotine is a big one, and so avoiding all nicotine is critical for the health of the discs and all the tissues in the body. If you have arthritis, you can treat it by exercise, flexibility, strengthening, but ultimately if there's an instability problem or a bone spur that's pinching and causing a problem, then that may need to be removed if it's pinching on a nerve and you're getting arm or leg pain as a result of it. Or we can take a disc out and put an artificial disc in or do a fusion to treat certain things if that's a concern. So there's not once you have arthritis, there's not a medicine you can take or a shot you can take that will make it go away. And there are things we can do, but hopefully just a good exercise program and maybe some anti-inflammatories, maybe a steroid injection will help calm things down enough to help.
Dr. Schuler, so when patients have arthritis, how do they make it go away?
You know, that's what everybody wants. Okay, doc, get your magic wand out, give me a pill, make this thing go away, and that's not reality. When you have arthritis, it's because genetics has predisposed you to that, a trauma has predisposed you to that, and so you have it. And you have it the rest of your life, unless a surgeon would cut it out or carve it out, but that's not something we want to do just out of the gate. And so the answer is you have to stay engaged in a program of flexibility and exercise for life, because when you stop moving, it hurts. And I know my own experience, because I have lots of arthritis of the spine, is that when I slack off my exercise program because I get involved in other activities or I have too much of a schedule, I hurt. And that's Mother Nature's way of trying to say, hey, get on the wagon and start doing your exercises. So I get this constant reminder if I slip up and I need to do it. But arthritis is something that you have for life, and there are things we can do to help you and keep you functioning, but you must be engaged. You have to be an active participant. And if you aren't doing your part, you're gonna hurt, and you'll get more stiff and you'll have more problems, and then it becomes a little bit of a downward spiral where ultimately do we have to fix it or can it be fixed? We don't want to do things that aggravate it. So heavy impact activities may make you feel worse. Well, if it's making you feel worse, you shouldn't be doing that. If you say, I go for a run and I hurt, well, are you running on a soft surface? Are you wearing good shoes? If you run on a soft surface and you have good shoes, maybe you can do it. But if you're running on pavement and you're trying to run a marathon and everything's hurting, Mother Nature's trying to tell you not to do that. So the question is, can we get you conditioned and trained? Can we do some modifications through the right rehab or any other treatments, injections, medicines to get you to the point you can function? But we don't want you to put a Band-Aid on it and then go out and injure something. So we have to understand what your problem is, how many levels of the spine are involved, and then what are you doing to optimize it?
Now, Dr. Schuler, patients ask all the time, they've identified, or someone has told them they have a bone spur and they want you to shave it away. What is your answer?
We get asked that a lot. You'll see an x-ray and there'll be a big spur sticking off the side of the spine right at that level, or in one of the facet joints, and they'll go, hey doc, just go in and shave that away. And we may do that if we're going in to do a fusion or some other big operation, but typically depending on where it is, we can't just cut it away because that's part of the natural supporting structure of the spine. So you have ligaments that attach one bone to another, you got muscles inserting, there are all these structures that we need, and if we shave away the spur, we also shave away all those supporting structures with it, which then creates instability, which then means we need to do either a fusion or a disc replacement or something like that. So just shaving away a spur is not an appropriate answer unless that spur is back in the spine canal where the nerves run and we're just unpinching a nerve. If we're unpinching a nerve because somebody has arm symptoms, then we may be able to shave away a spur. But for the most part, you can't just shave away a spur and make the arthritis go away. The underlying problem is still there.
I'd like to add that bone spurs don't cause pain necessarily, and so even if identified on an x-ray, it does not mean it's a source of a symptom or a problem.
Right. The spurs aren't painful. If they pinch a nerve, then you can have nerve pain related to it, but spurs themselves are not painful. For what we deal with in the spine, the spurs that we're talking about are for the most part related to osteoarthritis. And you know, I would say that 98% of the patients we treat, osteoarthritis is the problem.